1 in 2 people over 60 is dangerously low on vitamin B12 right now and has absolutely no idea. And the symptoms? Your doctor is calling them something else entirely. In the next 12 minutes, I'm going to show you 5 warning signs your body is screaming at you right now so you can fix this before the damage becomes permanent. I had a patient, 67 years old, told by 2 different doctors she had early onset dementia. 6 weeks after correcting her B12, she was a different person. And sign number 4, your body has been showing you this every single morning. You just didn't know what you were looking at. Here's what nobody's telling you. B12 is not just a vitamin. It is the raw material your nervous system uses to function. Every single nerve signal traveling from your brain to your hands, your feet, your heart, it depends on B12 to get there cleanly. Think of your nerves like electrical wires. B12 is the insulation wrapped around them. When that insulation wears thin, the signals start misfiring, and the symptoms that follow, they look like a dozen other conditions. That is why this gets missed. That is why people suffer for years before anyone checks a simple blood test. Let's fix that right now. Sign number 1. Sign number 1, the fatigue that sleep cannot touch. Start here because this is the one almost every person over 60 has accepted as normal. You sleep 7, 8, sometimes 9 hours. You wake up and you are still exhausted, heavy, foggy, like you never slept at all. And someone, a doctor, a family member, maybe even yourself, told you that is just what getting older feels like. I want you to hear this clearly. That is not aging. That is a medical symptom. Here is the mechanism. B12 is essential for your body to produce red blood cells. Red blood cells carry oxygen. When your B12 drops, your red blood cell production drops with it. Less oxygen reaching your muscles, less oxygen reaching your brain. Your body is running on fumes, and no amount of sleep fixes a fuel problem. This is the part that changes everything. Most fatigue in people over 60 is written off as lifestyle. Too sedentary, too stressed, getting older. But B12-related fatigue has a specific fingerprint. It does not come and go. It is there when you wake up. It is there after a full night of rest. It is there after a vacation. It does not respond to coffee the way it used to, and it gets worse over months, not days. Ask yourself right now, when was the last time you woke up feeling genuinely rested? Not just functional, actually rested. If you cannot remember, that is information. The fix is not a nap. The fix is a blood test. Ask your doctor specifically for a serum B12 level, not a general panel, that specific test. Optimal levels sit between 400 and 800 picograms per milliliter. Most labs flag deficiency below 200. But research published in the European Journal of Clinical Nutrition found that neurological symptoms can appear in patients with levels between 200 and 400. That range is called the gray zone. Millions of people live in the gray zone and get told their results are normal. Now, here is what surprises most people about sign number 2. Sign number 2, tingling, numbness, or a pins and needles feeling in your hands and feet. This one is being misdiagnosed on a massive scale. If you have tingling or numbness in your hands or feet, there is a very good chance your doctor looked at your age, looked at your circulation, and told you it was peripheral vascular disease or early diabetic neuropathy, and they may have started treating you for that. Here is what the research shows. A 2019 review published in the journal Nutrients analyzed patients presenting with peripheral neuropathy, that tingling, numbness, weakness in the extremities, and found that B12 deficiency was an underlying or contributing factor in a significant portion of cases that had been attributed to other causes. Remember those nerve wires I mentioned? When the B12 insulation wears down, the first places you feel it are the furthest points from your brain. Your hands, your feet, your toes. The signal degrades on the way there.
What you feel as tingling is actually a nerve misfiring because it no longer has adequate insulation to carry the signal cleanly. Here is why this matters urgently. Nerve damage from B12 deficiency can become permanent if it goes uncorrected long enough. This is not a condition where you have unlimited time to figure it out. The nerves can be repaired in early stages. In later stages, the damage is irreversible. So if you have been living with tingling hands or numb feet and you have never had your B12 tested, that changes today. And that connects directly to sign number 3. Because the same nerve degradation happening in your hands and feet, it is happening in your brain. One of my patients described it perfectly. He said he felt like he was thinking through wet concrete.
Sign number 3. Personality changes, depression, and anxiety that appeared out of nowhere. I want to say something that might be difficult to hear. If you or someone you love has been prescribed an antidepressant in the last few years, especially after 60, and nobody checked a B12 level first, that is a failure of standard care. I am not saying antidepressants are wrong. I am saying that B12 deficiency can produce symptoms that are clinically indistinguishable from depression. Persistent low mood, loss of interest in things you used to enjoy, irritability, sudden anxiety, emotional flatness, a feeling of not quite being yourself anymore. Here is the mechanism. B12 is directly involved in the synthesis of serotonin, dopamine, and norepinephrine, the 3 neurotransmitters most responsible for mood regulation. When B12 drops, neurotransmitter production drops, the brain's chemistry shifts, and the shift presents exactly like a mood disorder. A 2020 study from the University of Derby found a statistically significant association between low B12 levels and increased symptoms of depression and anxiety in adults over 60. Participants who corrected their B12 deficiency showed measurable improvement in mood scores within 8 to 12 weeks, without any change to psychiatric medication. I tell my own family this: before you accept a psychiatric diagnosis, get your nutritional labs checked. B12, folate, vitamin D, iron. These 4 tests cost almost nothing. A missed deficiency can cost you years. The memory piece is important here too. Not just mood, but cognitive sharpness. Forgetting words mid-sentence. Walking into a room and having no idea why. Losing your train of thought in a conversation. These are not always early dementia. Sometimes they are B12. And unlike dementia, B12 deficiency is fixable. Your doctor told you to do the opposite with sign number 4. The science says otherwise. Sign number 4, a smooth, swollen, or burning tongue. Every single morning you look at your tongue in the mirror, or you brush past it without looking at all. Either way, your body has been trying to tell you something, and nobody taught you how to read it. A healthy tongue has texture. You can see tiny bumps across the surface. Those are called papillae. They contain your taste buds. When B12 drops severely, those papillae atrophy. They flatten. They disappear. What you are left with is a tongue that looks unnaturally smooth, almost polished. Sometimes it is swollen, sometimes it burns or feels sore for no reason you can explain. Sometimes food stops tasting the way it used to. This condition has a name, glossitis, and it is one of the most reliable physical signs of B12 deficiency, documented in clinical literature going back decades. A 2021 case series published in the British Journal of General Practice described multiple patients whose B12 deficiency was first identified through oral examination, specifically the smooth tongue presentation. Here is what I want you to do right now. Open your mouth, look at your tongue in the light. Does it have texture across the surface, or does it look unusually smooth, almost like the surface has been ironed flat? Is there any burning sensation? Any soreness when you eat acidic foods? If any of those apply, that is a clinical sign, not a maybe, not something to monitor, a sign that needs a blood test this week. Now, sign number 5. This is the one that genuinely shocks people, because this one has sent people to cardiologists, stress tests, full cardiac workups, and every single result came back normal, because they were looking in the wrong place. Sign number 5, shortness of breath, and a racing heart with no cardiac explanation. Let me show you exactly what I mean. Your heart is racing, not from exertion, just sitting there. Or you climb one flight of stairs and you are winded in a way that frightens you. You go to your doctor, they run an EKG, they do an echocardiogram, they put you on a treadmill. Everything comes back normal, and you go home more confused and more scared than when you arrived. Here is what happened. Go back to sign number 1, the red blood cells. When B12 deficiency reduces your red blood cell production, your body compensates. Your heart beats faster to circulate the fewer oxygen-carrying cells you have. Your lungs work harder to pull in more oxygen to make up the deficit. The result? A racing heart and shortness of breath that has nothing to do with your cardiovascular system. Your heart is fine, your lungs are fine. Your blood is the problem. Specifically, what is in your blood. This is called megaloblastic anemia. B12 deficiency causes your body to produce red blood cells that are abnormally large but functionally defective. They cannot carry oxygen efficiently. And the cascade of symptoms that follows, the fatigue from sign number 1, the racing heart, the breathlessness, all of it traces back to that one deficiency. A study published in the American Journal of Hematology tracked adults over 60 presenting with unexplained cardiac symptoms. A meaningful percentage were found to have underlying megaloblastic anemia driven by B12 or folate deficiency. Once corrected, symptoms resolved in the majority of cases without any cardiac intervention. I want you to sit with that for a second. People going through the fear of thinking something is wrong with their heart, thousands of dollars in cardiac testing, months of anxiety. And the answer was a $12 supplement and a dietary change. Now, let's talk about what you actually do about this. Sit up straight for me, right where you are. I want to walk you through exactly what to do in the next 48 hours if any of these 5 signs apply to you. You might want to save this video for this part. First, the blood test. Call your doctor tomorrow. Ask specifically for a serum B12 level and a complete blood count. The CBC will show whether your red blood cells are abnormally large. That is the megaloblastic pattern that confirms deficiency is affecting your blood production. If your doctor pushes back, you can request these tests directly through any private lab. They are inexpensive and they do not require a referral in most states. Second, the form matters. If your B12 comes back low, the supplement form you choose determines how much you actually absorb. Standard cyanocobalamin, the most common form in grocery store vitamins, is the least bioavailable option, particularly for people over 60. Your stomach acid production naturally declines with age, and B12 absorption is heavily dependent on stomach acid. The forms I recommend are methylcobalamin or hydroxycobalamin. Both are more readily absorbed. Both are gentler on the system. A sublingual tablet, one that dissolves under your tongue, bypasses the stomach entirely and goes directly into the bloodstream. For severe deficiency, your doctor can also administer B12 injections, which bypass absorption entirely. Third, look at what is blocking your B12. This is the part most people never hear. If you are taking a proton pump inhibitor, a medication for acid reflux like omeprazole, pantoprazole, or lansoprazole, that medication is directly reducing your stomach acid, and therefore directly reducing your ability to absorb B12 from food. If you are taking metformin for blood sugar, research published in the Annals of Internal Medicine found that long-term metformin use is associated with significantly reduced B12 levels. These medications are not wrong, but your doctor needs to be monitoring your B12 if you are on either one. Fourth, the dietary piece. Animal products are the primary dietary source of B12. Beef liver contains more B12 per serving than almost any other food on Earth, roughly 70 micrograms per 3-ounce serving, against a daily requirement of 2.4 micrograms. Clams, sardines, salmon, eggs, and dairy all contribute meaningfully. But here's what most people over 60 do not know. Even if you eat meat regularly, your ability to extract B12 from food declines significantly after 60 because of reduced intrinsic factor production in the stomach. Intrinsic factor is the protein your stomach produces to bind B12 and shepherd it into absorption. Less intrinsic factor means less absorption, regardless of how much B12 you eat. This is why supplementation becomes critical after 60 in a way it simply was not at 40. Now, before I give you the rapid recap,
Which of these 5 signs surprised you most? Tell me in the comments. I read every one.
The close. Let me bring this together fast. Sign number 1, fatigue that sleep cannot fix. That is your red blood cells failing to carry enough oxygen. Sign number 2, tingling or numbness in your hands and feet. That is nerve insulation breaking down. Sign number 3, depression, anxiety, brain fog, memory lapses. That is your neurotransmitter production failing at the source. Sign number 4, a smooth burning or swollen tongue. Your body has been displaying this sign every single morning. Sign number 5, shortness of breath and a racing heart with a clean cardiac workup. That is megaloblastic anemia, and it is reversible. Your B12 system is now mapped. You know what to look for. You know what to ask your doctor. You know what to take and why the form matters. But here's what I need you to know. B12 does not work alone. There is one other deficiency that mimics B12 almost perfectly, and the two are so intertwined that correcting one without checking the other can actually mask the second condition and delay its diagnosis. I made a video on exactly that. Watch it next. It may be the most important follow-up to everything you just learned. Save this video, come back to the application section, and go get that blood test. Which number surprised you most? Drop it in the comments below.